Hello, my name is Mark Jensen, and I'm the manager of behavioral health here at QuadMed. Today, I would like to talk to you a little bit about uh, understanding the signs and symptoms of distress that we'll find in either yourself, your children, coworkers, friends, people you run into on a regular basis. So we want to be able to understand what are those signs and symptoms of the emotional distress so that we can be able to provide, the necessary help someone may need. So we first want to understand what emotional distress is. In order to do that, we have to understand kind of the definition here. Emotional distress is a state of mental anguish that can take a wide variety of forms. It may result from a mental health condition or a particular circumstance, such as relationship difficulties or financial strain. Emotional stress really comes from stress that we have that's triggered. And it can be a wide variety of things. It can be something small. It may seem small to someone else, but it could be big for you, or it can be a big event that would happen. So again, we're just looking at it's creating something within you that is creating some problems for you, or just not able to allowing you to function the way you want to. So when we go through this, unfortunately, a lot of people do not really seek help. They're afraid to. They don't want to admit that they're unwell. They're afraid, this. If I talk to someone about this could affect my work. They feel alone. They are just embarrassed about the stigma of what they're going through. So people will likely not want to speak to that. That's where we kind of hear that term, I feel fine. Usually when someone says they feel fine, there's a lot more behind that. Um, why don't people speak up when they see distress in others? It's that fear of invading privacy, the perception that you're not allowed or it's not a business like to reach out. So if you're a supervisor or manager, you may feel like this is not my place. This is not what I should be doing. Or they just lack the comfort in knowing how to address it. So again, we want to be able to just what you really need to be focused on is just speaking to the person, as you would like to be spoken to. Sometimes just saying, hey, I'm noticing that you're just not seeming like yourself. There's something going on. Again, you're not there to diagnose or fix the problem, but just giving that outlet to someone to say, hey, if you need to talk, I can talk to you, or we can find someone that can, professionally talk to you if it's an issue that is something that would need that attention. So we want to look at the signs and symptoms. So I've broken these up into adults, children, and adolescents, and then we'll have a slide too on just if you run into it in the workplace. So signs and symptoms in adults, we're seeing feeling hopeless or helpless, uh, loss of interest in daily activities. So you're not doing the things that you used to enjoy, or you're not finding that fulfillment in those things you used to enjoy. You're noticing a change in your appetite or weight, and that would be really a large amount of weight loss or weight gain in a short period of time. So we're talking like, 20 pounds in a month that you either gain or lose, and you're not actively trying to do that. Changes in sleep, and again, this is a big indicator for a lot of people. Having that difficulty falling asleep, staying asleep, waking up early. So you're waking up at 3 o'clock in the morning, and you're just kind of wired for the rest of the day. Um, so that's a big one to pay attention to. Anger, irritability. So small things are just really causing you to feel real irritable. Not having a lot of energy, self-loathing, reckless behavior. So putting yourself in situations that may be considered risky, things like driving fast or maybe starting to use substances. Concentration problems, you're just having difficulty just focusing on what you need to be focusing on at that time. And then the unexplained aches and pains. So you have these things that are happening, but you just really, there's no explanation to why I should be feeling that ache or pain. I haven't been, active or doing anything that would cause that. When we look at children, we see a lot of the same symptoms we see in adults, but there's going to be some different ones as well. So they're going to have difficulty in initiating or maintaining social relationships. So just not making friends or hanging around friends that they have. Extreme sensitivity to rejection or failure. So You may just see an outburst because they feel that they're being rejected or they failed at something. Frequent absences from school or sudden decline in grades. That there's a lot of sadness or tearful and crying, low self-esteem. In younger children, we're going to see an increased frequency of tantrums that go above and beyond what a normal child would do. Obsessive fears or worries about death. Again, we've talked about the social isolation. Um, Talking about or attempting to run away from home, or thoughts or expressions of suicide or other self-harm behavior. So we can see things like cutting. So I think definitely signs you want to kind of pay attention to in your child. When we move to adolescence, again, we're going to see a lot of the same things, but we're going to see an increased risk in uh, increased interest in topics of death. Again, increased risk-taking behaviors, excessive or appropriate or inappropriate feelings of guilt, feelings of worthlessness or self-hatred, substance use, a short temper, and again, dealing with adolescents, tempers do come, but we may notice that this temper is a little different than what I've seen before. And then again, trouble making decisions or just trouble just concentrating on things they need to be concentrating on. So again, these are all important signs to be looking at in ourselves and our children. I always say that, in order to model good self-care and self-awareness, we need to have that for ourselves. So just to make sure you understand, all right, what is not a normal feeling for me, and being able to speak to that is a good way to model that for your kids, and to say, if you're not feeling right, you need to come talk to me and we can help figure this out. I think it's also important to be able to recognize the signs and symptoms in our coworkers. We spend a lot of time with the people we work with. They become almost family to us in some situations. So, these are signs to look at. If you're noticing lower work quality or lateness to work, if you're noticing procrastination, or there are more accidents or more near misses on the job, indecision or trouble making decisions about the work. If you're noticing frequent trips to the doctor, or just an overall poor work quality, the person may be missing deadlines or just absent a lot, having poor relationships with coworkers, boss, or clients. So they may have been someone that, has really been active with everyone else, but then they seemed a little more closed off. And then again, just being there, just not feeling like that person, they're in the room, but they're not necessarily there. So again, these are good things to pay attention to your coworkers. If you're a supervisor or manager, to your employees, and if you noticed any of these things happening, really just stepping up and saying, hey, again, I know you're just not acting the way you usually do. Is everything all right? And they may say everything's fine, but you've now opened up that dialogue, and hopefully, if as they become more comfortable, they can come talk to you. And again, you're not there to solve the problems. We're just there to make sure that the person's getting what they need. So it may just be a referral to your EAP, or helping them just understand that, all right, this is a problem that you need to go talk to someone, and doing our best to be able to help guide them in that direction. So these are all things that we need to look out for, and good tips to be able to talk to people about. So I encourage you to review this, understand this, and again, like I said, being a good role model for yourself, and understanding this will help others understand this. So I appreciate your time you've taken with me, and if you have